I am Dr. Zainul Abidin. I am a children cancer doctor. I am here to talk about children's leukemia or children's blood cancer. I have list of things to tell you. Before I talk about detail about blood cancer in children, I would like to briefly explain basics of blood cells, blood stem cell and bone marrow. You can see the picture. There are three types of blood cells: red blood cells, RBC, white blood cells, WBC, and platelet. Role of RBC is to carry oxygen to various parts of the body, and role of WBC is fight against infection, and role of platelet is to prevent bleeding. These blood cells are developed from the stem cell. They are seen in the bone marrow. Bone marrow is a spongy tissue inside the bone where blood cell stem cell are seen. So these stem cells divide and develop and mature into various types of blood cells. You can see from the picture, this division and development happening in a very controlled fashion. So when this control is affected, children develop leukemia. Now I would like to explain to you how the leukemia develop in the body and how its signs and symptoms develop. So as I mentioned before, this stem cell divide and develop into various types of blood cells in a controlled fashion. When this control is affected, for reason nobody knows, instead of maturing into normal, they develop into abnormal cell called blast cell. They are the cancer cells in blood cancer. So this blast cell divide and multiply very fast. This blast cell affect normal development of RBC, which lead to anemia, normal development of WBC, which can cause infection and fever, and normal development of platelet, which can cause bleeding. This blast cell come out of the bone marrow and goes to liver, spleen, and brain and lymph node. So when it goes to liver size increased. When it goes to spleen and lymph node, size of the spleen and lymph node increased, which can also spread into the brain. And at this point, if we confirm the leukemia and we don't treat the leukemia, then it can spread all parts of the body and it can affect all function of the body and it can lead to death. So from this explanation, you can understand what are the signs and symptoms of leukemia, which include anemia, fever, bleeding, enlarged spleen, liver, lymph node. At this situation, you need to understand there are simple disease also can cause this kind of signs and symptom. However, at this situation, it is better to consult a pediatric doctor. If they suspect blood cancer in that particular child, they will advise to do a simple blood test called complete blood count, which will tell us is there anemia, low platelet, or abnormalities of WBC. So if we suspect based on this complete blood count and other signs and symptoms leukemia, he will suggest to do a special test called bone marrow examination. Bone marrow examination is nothing but taking small bit of bone marrow from the back of child hip bone by putting a needle. It usually done under anesthesia. After taking this bone marrow sample, which is looked under microscope by a specialist doctor, they are called pathologist. They will tell us is there any blood cancer cell in the bone marrow. That is how we confirm blood cancer. Once the blood cancer is confirmed, they will do some more special tests which include immunophenotyping, which will tell us what are the type of blood cancer, which I will explain to you later, and which they will also do genetic test which will tell us various grade of leukemia. At the same time, they also do a special test called Csf test, which is to understand whether leukemia spread to the brain or spinal cord. Csf is a fluid around the spinal cord as well as brain, and we can take few drops of Csf by putting the needle at the back of spine. This is called lumbar puncture. By taking that fluid, again pathologists look under microscope to see whether any blood cancer cells or blast cell in the Csf. So by doing all this test, doctor will understand what type of leukemia and what is the grade of leukemia. That will tell us how we should treat leukemia in children. So back to the question, what are the type of leukemia? There are 4 types of leukemia. Among these 4, 3 types of leukemia are seen in children. The most common is acute lymphoblastic leukemia. Second is acute myeloid leukemia, and third is chronic myeloid leukemia. Now you know what are the types of leukemia. Now I would like to explain to you what are the treatment available for leukemia. So the main treatment of leukemia is chemotherapy. Chemotherapy is medicines which can be given by injection or by mouth. This chemotherapy will destroy blast cell or cancer cell. It is important to start treatment with chemotherapy in the case of leukemia. So there are different combination of chemotherapy available. So how we decide which combination we use particular child? So it's called risk stratification based on various factors, that is age or WBC count at the time of diagnosis and the test result of genetic test and immunophenotypic test. Based on this, we can classify leukemia into high risk leukemia, low risk leukemia. Low risk leukemia can be treated easily with the low quantity of the medicine, and high risk leukemia we need to treat with strong combination of medicine. Now you may ask, what is the role of bone marrow transplantation in the treatment of leukemia? As I mentioned before, the main treatment of leukemia is chemotherapy. However, in some situation, we may use bone marrow transplantation, especially when the leukemia has come back, or based on the initial test, if we think the leukemia is very high risk, then we may use bone marrow transplantation after chemotherapy. Now you may need to know about the outcome of leukemia. Leukemia is one of the common children cancer and easily treatable cancer in children. For example, acute lymphoblastic leukemia, this is the most common childhood cancer and most common childhood leukemia. The treatment result in various centers all over the world more than 90%. That means out of 10 acute lymphoblastic leukemia, 9 children will be cured. Acute myeloid leukemia, the result is not as good as acute lymphoblastic leukemia. However, more than 50% of acute myeloid leukemia can be cured. So I think I have covered most of the common question you may come across or you may need to know about childhood leukemia. However, if you want to understand or if you want to clarify further, you can contact me through my WhatsApp or by email. Thank you very much.